how happy and excited that he's here with us and looking well, and for the role that is before us, and also his decisive leadership over our nation at this difficult time. I'd also like to thank the Honourable Minister for Economy for the budget. And I can say that we in the Ministry of Health have been very fortunate that despite the challenges that we've had over the last 2 years, we've been able to be supported, given that other ministries have had their budgets reduced in certain areas, to be able to do the role that is set out before us. So certainly over the last 2 years, our main focus has been on the COVID response and also on the vaccination campaign. Now that we are coming to the tail end of that pandemic as it is, we are able now to reach out and to tackle also the other emerging threats, whether it be communicable and non-communicable diseases that is upon us. Mr. Speaker, sir, at the outset, I would like to commend again the government's move in re-establishing the overtime pay for all civil servants and Band E and for the nurses. They have been at the front line. They are the spine and the bone and the skeleton of the health system. And I have heard last night that all throughout the country they have been very happy. Not only that, but maritime and rural allowance has been restored when this budget will be passed. Honourable Speaker, also the meal allowances, and this has also been well received. And the Minister for Economy had alluded that when these allowances and overtime was withheld in that budget speech, that all of us were indeed sacrificing, including us in this Parliament, with salary cuts, and they were done to be able to support the nation during that difficult time. So we are thankful for that allowances to be brought back, and it will support them. And also the fact that appropriation has been set aside to be able to reward those who have been at the front line, those who have been working hard, those who have been working 24/7 some days, whilst the rest of us were contained in our own homes throughout that time until now. We've been very fortunate that recently we've been able to give leave to a lot of our staff, and they are now being back refreshed at the work that's before us. Honourable Speaker, the GP scheme has become very, very important. It's important because it increases again the access to primary healthcare services. We are fortunate, and again like to thank the Minister for Economy and the Honourable Prime Minister for setting aside appropriation not only to continue the scheme, but also to increase the number of general practitioners, and more importantly, the work that they can do, such as blood tests, tests for diabetes, tests for ECG, nebulizer treatment. As we know, some of our people, when they front up to the nearest general practitioner, they may have an asthmatic attack, and now that's actually being paid for and subsidized by government. And this is something that all of us should be very happy with, that our people will be able to be provided to the next available health facility, whether it be a GP or a health center close to them. And the numbers again have increased, as I've alluded to earlier. The old school way of lining up at a health center is now beginning to go out of the window. The Honourable Minister for Economy had said it in his previous budget address, that we are moving towards having a doctor looking after a person or family, and that's what family medicine is all about. By doing this, it creates a trusting relationship. When I worked in New Zealand for 3.5 years, and I know all of you who have worked overseas would have had a private GP that looked after you and looked after your family. And that confidence that you have with your general practitioner allows you to be able to share the most intimate and difficult things that need to be sorted. And that's what this program is beginning to do. And we are very grateful that again, we are able to open it up to a lot more GPs, and also the appropriation of 200,000 to look at having this available also in rural areas, such as Nawaithomba, Malolo, Rasa, Sambeto, Seganga, Riketi, and Nasarawak. Imagine having a general practitioner who's like your family doctor, looking after you in these places. Unprecedented. And again, commend the Minister of Economy for his foresight in supporting this incentive. And this will again continue to strengthen our resolve to have access everywhere so that we are definitely leaving no one behind. Honorable Speaker, on Sunday, March the 22nd, I had the pleasure of spending the day predominantly with our oral health professionals around the country. And I want to thank them for the work that they've done. And during the pandemic, they were part of the frontliners. A lot of them were being used as swabbers. As we all know, oral health professionals know the anatomy of the oral cavity very well, and they can be trusted. So I thank them on behalf of the Honorable Prime Minister and on behalf of a grateful nation. And this week is National Oral Health Week, and it's being celebrated right across the nation, where free oral health checks are being done. Pleasing to note that in yesterday's budget address, the Honorable Minister of Economy also alluded to the fact that private dental practitioners will now join the GP subsidy scheme. This is another step forward in increasing access to all our people. Not only will they have dental checks, but the ability to deal with acute dental issues. And again, I've begun to receive messages from dentists and oral health professionals, not only in the public sector, but also in the private sector. In our public sector, Honorable Speaker, when a person comes for a dental checkup, it's not like a doctor where you can see somebody for about 10 minutes. They need an appointment of at least 30 minutes. So on occasions, they may have just 40 rostered for the day, because certainly you need the machines to be up and running, you need the equipment, you might need to anesthetize the mouth before you actually take out the tooth. So you can see that now we'll be able to spread that, and then people can be able to have their dental appointments not only in the public sector, but also in the private sector. Honorable Speaker, the outsourcing of biomedical services will continue to support and streamline operations, and this is a key part of the approach to ensure that the ministry works in tandem with the biomedical services provider. We can hold them accountable if the machines have challenges, for example, and also improve on the quality of care. I note that also the kidney dialysis scheme, as we all know, continues with the availability of dialysis not only in the government hospital and the Nandera, but also the subsidy that's set aside of $1.2 million. And I'm very thankful for it. Honorable Speaker, the experts, the researchers in nephrologists continue to talk about how we also have to address the preventative measures with kidney dialysis, the work that needs to be done to continue to ensure that we're protecting our kidneys. So whilst these services are available in our 3 main hospitals and also in our Nandela kidney dialysis unit, and also being subsidized in the private dialysis units, the work around the preventative health aspects in preventing chronic renal failure continues, and that is also very important. Honorable Speaker, the free medicine scheme, as alluded by the Minister for Economy, was something that was never there until 2018. And this move has benefited many Fijians. In 2015, 72 medicines were made available. Since then, we have 140 medicines, 136 crops, and also 4 consumables, mainly wood dressings. We have more and more Fijians registering onto the scheme, and they need to apply through our ministry and simply show they qualify for any of our many social welfare schemes. We've also worked it so that somebody who qualifies for social welfare qualifies for the scheme and also potentially qualifies for the kidney dialysis. So beginning to see that we actually align those 3 together. The Fiji Pharmaceutical and Biomedical Service Center will launch an improved implementation model for free medicine program beginning next month. And under this new model, participating private pharmacies will dispense listed medications from their own inventory and will be reimbursed by the Ministry of Health and Medical Services. One of the things that we had wanted to do and we couldn't during COVID was actually change the way that we did our systems of logistics. And we are slowly able to transit it. At the moment, they have a new supply chain software called M-Supply, which they are now running. They've also changed the way that they actually deliver, and they do now a door-to-door logistics exercise. Whereas before they were dependent on third parties, such as courier companies, but now they actually do door-to-door. And because of the appropriation that was given in the previous budgets, they now have the transport and the people to be able to do this. Honourable Speaker, I would like to talk about a project that has also been very important, and that is the WASH project that our environmental health officers have been working very hard on. Honourable Speaker, it's been estimated that at least 80% or more of houses that are damaged during a cyclone would also have their WASH damaged, the sanitation damaged significantly. And we've had since Winston 14 severe cyclones. And a lot of them, because of the challenges they had with support they were able to receive from government, they were able to put a roof over their head, some of them struggled with latrines. And I know this because as I worked as a doctor and as a surgeon, I've operated on many people who have ruptured their intestines, ruptured it because of typhoid, ruptured it because of diarrheal diseases. Some of them died. When I was in that operating theatre, I never saw Kurundrani, Koko Kurundrani, I never saw Solotara Ndrondo, I never saw Honorable Bimban Pasari. This is how people died. And it was very close to my heart. And that's why when the cyclones went through Fiji, and we did assessment, for 3 weeks we were in Lekutu. Honorable Minister for Defense was in Nambasa. When we traversed through the communities in Bunolego, I never saw them. Never met any of the oppositions that's saying opening toilets is a waste of time. Never met any of them. When we had houses, many houses in Kandavo that were damaged, and the facilities were damaged, never saw Sibirasoba there, Honorable Sibirasoba. Never saw him there. Honorable Speaker, what I'm trying to say is very simply, our people went on the ground, they identified the problem, there were typhoid outbreaks, diarrheal outbreaks, leptospirosis outbreaks. They decided this is what needs to be done. We found funding for it. And if you look at the budget book, there's nearly $1 million set aside for WASH. And that's what they've done. What are the numbers? You said Mbua. Let me make it very clear, Honorable Salvatore Ndondo, that a lot of work has been done in Mbua. And if a typhoid outbreak broke out in Mbua, you could be sick. Your life has been protected. Honorable Speaker, let me tell you the numbers. The numbers indicate that with the work that they've done, they've been able to put in 1,286 latrines. These are people who have struggled to put up latrines after the cyclones, in the middle of Vitileo. Navasa, where Kokor Kurundrani and I come from. When there was a leptospirosis outbreak in Ra, and you were making fun of our people walking through, where were you? I was there with them. Went to a village called Nabawai. We hiked for more than an hour. Where were you? Never saw any of you. So why you make those comments? Let me tell you one thing. If somebody gets diabetes, it takes a time, Honorable Speaker, to get diabetes. We have time to deal with the issues. We have time to be able to talk to them and advocate. When somebody gets typhoid today, he can die 2 days later. Somebody gets leptospirosis today, he can die 2 or 3 days later. That's the difference between communicable diseases and non-communicable diseases. So once we fight this NCD, we must remember that the emerging threat of communicable diseases can kill people. There's a high mortality from it. It can affect those who need to be able to put food on the table. It can affect people who are going to work. It can affect our people who are going to work in areas where visitors might come and intermingle with them. That's why it is so important to deal with all the threats to health. Not only non-communicable diseases, but also communicable diseases. We need to deal with leptospirosis. and nip it in the bud. We need to deal with dengue and nip it in the bud. We need to deal with typhoid and nip it in the bud. And they've done magnificent work. To make certain comments such as that is to insult the hard work these environmental health officers have been doing. Some of them have been sleeping in communities, working with them, supporting them. And they've worked very, very hard. So the next time you want to make a comment, think about the sons and daughters of Fiji who work very hard as frontliners for COVID. They'll have to work very hard as frontliners for leptospirosis, typhoid, and dengue. Remember them. Because if you think that you're supporting civil servants, you're not supporting civil servants. They are the ones who carry out the policy of government. They are the ones who are protecting our lives. They are the ones who are putting their lives on the line for us. Honorable Speaker, the opposition and various have criticized the budget, but they have not done so in measured terms. They have not provided viable alternatives that will help create realistic opportunities to reposition the Fijian economy to operate under the new normal. Honorable Salvatore Rondo said, only fools will believe this budget. After yesterday's event, the Facebook went wild with people across this nation saying how good this budget was. And you're saying they're fools? You call the people of our country who say that this is a good budget fools? Is it saying they're fools? The criticisms and judgments cannot change the fact that at this juncture in the Fijian economy, there cannot be a smarter and more responsive budget than this. Mr. Speaker, sir, the government's view that all Fijian families matter and no one gets left behind. No one. My ministry will continue to effectively mobilize its allocated budget and programs to deliver an effective response to the pandemic, tackling other emerging threats, and improve the delivery of medical services. Mr. Speaker, sir, I know that when Fijians unite in the face of our challenges, our nation will emerge stronger and better than this, and therefore, Honourable Speaker, I support the 2021-2022 budget revision, and I call on all Fijians to unite and help in the transformation into more resilient and stronger people and Napoli.